Welcome, and thank you all for registering and joining us as we launch our Oncology Nutrition Education Series. Nutrition is an integral part of our cancer survivorship program at Intermountain Health and a very important piece of the complex care for anyone who has been impacted by cancer. This series is designed to provide you with the knowledge and tools you will need to optimize your well-being, enhance your quality of life, and be confident with the food choices that will help you no matter where you may be in your cancer journey. This on-demand session will include 45 minutes of content, and we will conclude with questions from our live event. So again, thank you for joining, and I'm very excited to introduce Lacey Mozingo, one of our experienced oncology dietitians from Logan Hospital, who has so much knowledge and information to share with us today. Lacey?
Thank you, Des. Welcome, everyone. I am so glad that you're joining us for our first class in our Oncology Nutrition Education series. My name is Lacey Mozingo, and I am a registered dietitian who specializes in providing nutrition therapy to those diagnosed with cancer. I have worked at Intermountain Health at the Gosner Cancer Center in Logan, Utah, for about the past 5.5 years. In that time, I have learned a lot about nutrition and cancer. And working with cancer patients for me is a little bit of a love-hate relationship. I hate that anyone has to go through that burden of being diagnosed with cancer and the treatments that come, but I love being able to empower people by teaching them what they can do with their diets to help them stay strong and fight back against their cancer. This new program was designed by a team of oncology dietitians here at Intermountain to be able to provide evidence-based information in a way that is both accessible as well as timely for those diagnosed with cancer. Often I have found in my practice that people who have been diagnosed with cancer often have significant barriers to accessing reliable and evidence-based nutrition information. Whether that's because of, you may not know where to look, financial limitations, time constraints, or even just because of the emotional and physical strain of cancer. Sometimes you're not always ready for that information right up front. Because of these potential barriers, we wanted to create a type of class that could be offered online for anyone diagnosed with cancer, as well as for their loved ones. As we started developing this webinar series, we found that it would also be beneficial to have these classes recorded and have them on demand so that those who were unable to join the live event could still have access to this good information at any time. So, as I said before, I'm very excited to be with you all today, and thank you again for joining us. For today's class, we are going to talk about the basic nutrition guidelines and dietary recommendations for those who have been diagnosed with cancer. We'll discuss what the current research shows and how this translates to our day-to-day meals. We will then talk about the different types of cancer treatment and identify some of the more common nutrition-related side effects from those treatments and how this can change those diet recommendations. Lastly, we'll talk about what resources are available to you and your loved ones that can further help you along your cancer journey. As mentioned, we will also leave some time to review some of the questions that we received during our live session and give some good feedback on those. Now, before we dive into what we talk about today, I did want to ask a couple of questions to get our minds thinking, but also on the same page, as well as to define some terminology that we'll be using throughout the rest of this class. So, first question, which statement is true about carcinogenesis? Is it A, a process by which normal cells transform into cancer cells? B, a result of accumulated genetic damage? Or C, nutrition can play a role throughout all stages of carcinogenesis, or D, all the above. And this is all the above, the correct answer. So carcinogenesis is the term that describes the process of cancer development and growth. And it is true that more research is finding that nutrients can play different roles at different stages of carcinogenesis. Some nutrients have been shown to have a protective effect, while others can potentially cause harm. And so we'll talk more about what those nutrients are and what foods we find those in as we go through today's presentation. Second question, what are phytochemicals? Is it a food additive that helps increase shelf stability? B, a harmful chemical produced by cancerous cells? C, a beneficial chemical compound produced by plants? Or D, phyto what? Your guess is as good as mine. So correct answer is C, a beneficial chemical compound produced by plants. During our live session, I loved the honesty that, sometimes we don't always know these long terms for different nutrients that we find in our food. So the phyto what is actually pretty common that people may not know what these are. Phytochemicals are a non-nutrient chemical compound, meaning that they don't provide any calories, protein, or vitamins and minerals, but they are produced by plants, and research is finding that they have unique health benefits. Some of the examples of these phytochemicals include isoflavones, which are commonly found in beans, particularly dried beans like black beans, kidney beans, garbanzo beans, lentils. Another one is resveratrol. This can be found often in grapes, blueberries, raspberries. This is, in the last few years, some of the more common, uh, I should say more common information that has come out is that wine is healthy for the heart. The reason why it's healthy is because of the resveratrol. Now, still in moderation, and you can get this resveratrol from other healthy sources, as I mentioned, from fresh grapes, blueberries, and raspberries. Another example of a phytochemical would be flavonoids. These are found in grains, vegetables, and chickpeas primarily. And lastly, carotenoids are another example of a phytochemical. And I love this one because it's really easy to remember, because that first part of the word is carrot. And when we think of a carrot, it is that bright orange. And foods that have carotenoids in them are generally those vibrant oranges, yellows, even some reds that have that phytochemical in it. So those ones are pretty easy to remember. Okay, last question. True or false? Foods labeled as superfoods are the only nutrient-dense foods that are proven to help fight cancer. This is false. And it's false in the way that there's no single food that can protect or help you fight cancer all by itself. Often online, we see messages circulating that may put a particular food on a pedestal, claiming that it can prevent or even cure cancer. And this is unfortunately not true and is more of a result of either misinterpreting or overextending laboratory study results. What research does show is that a diet that is filled with a variety of fruits, vegetables, whole grains, beans, and other plant foods help lower the risk for many cancers. In laboratory studies, there are many minerals, vitamins, and phytochemicals that demonstrate those anti-cancer effects. And so that's where we do get that that mild misconception that, oh, this phytochemical fights cancer. But as I said, research is finding that it's not just one nutrient in a particular food that gives its anti-cancer effects, but more so it's the combination and the interactions of multiple nutrients. So why are we talking about this? Why is nutrition important? Now, you may think as a dietitian, I'm a little bit biased, which may be true, but as I have researched and learned more in cancer nutrition, I have found that it is important that we talk about nutrition because research shows that nutrients like vitamins, minerals, and phytochemicals can have that protective effect in preventing as well as fighting cancer. Good nutrition can help detoxify those carcinogens that we just talked about, protect DNA, as well as repair damaged DNA and other healthy cells. Good nutrition can also help promote cancer cell death. So whether you are at the beginning of your cancer journey or planning to start treatment, or even if you're recovering from treatments, it's never too late to start. Start making those healthy choices in your diet, as you will see a good improvement in your health and be able to continue to fight that cancer. Now, a common question that I see or that I hear is, what should I be eating? As well as, what shouldn't I be eating? With all of the different terminology in nutrition, the ever adapting research, as well as some of the misconceptions that we can hear or find online, nutrition can sometimes be a little confusing. My goal today is to help simplify what the current research is saying and show you what a healthy diet may look like for you. Now, an important side note, for all of today's class, we'll be talking about the general guidelines for nutrition and cancer. Unfortunately, in a setting like this, we really can't get into too many specifics, as there are many factors that affect a person's individual diet recommendations. So for more individualized diet recommendations, I really recommend that you reach out to an oncology dietitian to have that one-on-one discussion. Now there are talking about those evidence-based dietary guidelines, there are many nutrition experts and professional organizations that study today's current oncology nutrition research. Some of these organizations include the American Institute for Cancer Research, the World Cancer Research Fund, the American Cancer Society, as well as the Academy of Nutrition and Dietetics. Each of these organizations are great resources to find reliable nutrition information and find a good summary of what some of the key dietary and lifestyle recommendations are that have been shown to help in both cancer prevention as well as survivorship. And so let's dive into these, some of these more common guidelines. These include being a healthy weight, being physically active, eating a healthy diet, and limiting red meat, processed meats, processed foods in general, sugar-sweetened drinks, and alcohol. Now, we could have a full class on each of these topics, so for time's sake, we're going to focus primarily on what it means to eat a healthy diet. What this may look like is including lots of fruits, vegetables, whole grains, beans, and healthy fats. Now, I will be honest with you, research in nutrition and cancer is ongoing. As I said earlier, it's ever adapting. So we are still learning the full effect that a certain food or certain diet pattern can have on cancer development and growth. But from what we have seen in the scientific evidence, that their researchers have found that a diet that is rich in plant foods like fruits, vegetables, whole grains, legumes, healthy fats, these nutrients can reduce cancer risk and contribute to an overall healthier life. They have also found that there is strong evidence that diets containing higher amounts of fast foods and other processed foods that are higher in fat, starches, or sugar are a cause of weight gain, which can be linked to increased cancer risk. Because of these findings, it's often recommended that cancer patients follow the Mediterranean diet. This sometimes it can bring a little bit of a misconception. Often I hear from the clients that I work with that they're like, is that a Greek cuisine? Is that Italian cuisine? What happens if I don't like feta cheese or olives or fish? Um, the idea that the Mediterranean diet is a particular cuisine is a common misconception, because it's not that it's a typical or a specific cuisine type, but instead it is more of a dietary pattern. And this handout kind of shows what that pattern looks like. Essentially, it is emphasizing that eating of whole grains, fruits, vegetables, plant-based proteins, and healthy fats. It also encourages including low-fat meats like poultry, fish, dairy in moderate amounts, and encouraging limiting those red meats and sweets and only having those occasionally. Often how I explain it is, in the diet, all foods can fit. whether that's your sweets versus your fruits. All foods can fit. There's just some foods that we want to have more of the time, and other foods that we should have less of the time. An important thing to also keep in mind if or when you are told to follow the Mediterranean diet is that this diet pattern can be adapted to include the foods you like best. And by making small changes in your diet, you can have really big effects in your overall health. For example, let's take a look at the traditional American plate. On this photo, this is showing that, we have a very large piece of red meat, so large steak. It's about 8 to 12 ounces. We also have probably about 2 servings there of buttered mashed potatoes and also green peas. This plate, although you are getting good protein from the meat and you're getting calories, this combination can tend to lean to being a very calorie-dense meal. And so it may not be fueling your body as well as some others. So let's take a look of some changes or some adaptations that we can make to this meal to make it a little bit more plant-focused. Some of these changes could be reducing the overall size of that steak. So rather than going for something that's 8 to 12 ounces, let's go for something that's closer to 4 to 6 ounces. Let's swap out those high starch veggies for something that is higher in fiber and lower in that starch. So swapping those green peas out for some green beans or sugar snap peas. Those are going to increase the overall fiber content as well as decrease the overall calorie content. Let's also reduce the size of our starch, so that potato. In this example, we switched it to just 1 serving of rice. Now, you could still keep it as mashed potatoes, but rather than doing the 2 servings, let's decrease that so we focus more on those vegetables. Now, let's take that one step further. And as we kind of transition more to a plant-focused meal, a couple other steps that we can take. One could be exchanging that type of protein out for something that is lower in fat and leaner. So in this example, we swapped out that steak for some chicken. Also including a wider variety of different vegetables rather than just picking one vegetable, serve multiple. I always like to say, eat the rainbow, because as we talked about with those phytochemicals, they tend to be in different colors of vegetables. So your vibrant reds, yellows, greens, really make that plate beautiful, essentially, because you're going to be getting a lot wider variety of vitamins, minerals, and phytochemicals that are going to help you in your overall diet. We also made an exchange by adding in, rather than regular white rice, we switched in some higher fiber mixed rice. So in this example, it looks more like a quinoa or even just a wild rice, which is going to have more fiber than your typical white rice. So start where you're at. Make those small steps, those changes, and make it in a way that you are excited to eat. Now let's talk about when this diet is appropriate to follow and when it may not be appropriate. So our next question, this one is not a Slido, but it is, I just want you to think about this one. So true or false, the Mediterranean diet should be followed throughout all of treatment to get the best results. Now, this is a trick question. It is both true and false. As we have just talked about, there can be many health benefits to following more of a plant-based diet. These benefits can also be seen when people are receiving active cancer treatment. And so we do want to encourage more of that healthy diet, but because of the increased burden that cancer can have on a person's body, as well as the potential side effects from cancer treatment, it may not always be appropriate to follow the Mediterranean diet. In some situations, it may actually be more beneficial to your overall health to focus simply on eating enough calories and protein in order to protect your muscle mass and strength, sometimes regardless of the source of those calories and protein. I often describe this as if we're looking at two different situations. So, in situation A, as you're going through treatment or as you've been diagnosed with cancer, you may be feeling relatively well. Your appetite is mostly good, your symptoms are very well managed, and it's not interrupting your normal daily routine as far as eating goes. So you have more of a lower treatment burden. Now, in this situation, this is where we really want to encourage eating that healthy diet, being physically active, working with your team to be at a healthy weight, as well as limiting those red meats, processed foods, sugar, and alcohol. Now, in situation B, this is where your symptoms are either of your treatment or of your cancer are affecting what you can eat as well as how much you can eat. Whether that's because of nausea, vomiting, diarrhea, constipation, mouth sores, or even malabsorption from surgery, in this situation, we may need to focus on finding different types of foods and eating patterns to help keep you eating enough calories, because it's very important that we protect that muscle mass and that because those diagnosed with cancer are inherently at a higher risk for developing malnutrition. One of my primary roles as part of the cancer team is to help educate individuals and their families on how to adjust their eating habits to help them stay well nourished as they go through treatments. By staying well nourished, researchers have found that cancer survivors are more likely to have better immunity, improved wound healing, they're more likely to receive the full prescribed treatment and have less hospitalizations. They've also found in research that those with good nutrition can have less severe symptoms from their treatments. So for the remainder of class today, I want to discuss some of the more common nutrition-related side effects of cancer treatment and go through some ideas and suggestions of how to maintain that good nutrition despite having those side effects, because sometimes they are inevitable. So these are some of the more common symptoms that we see that affect how much or what types of foods you are able to eat as you go through treatment. These include loss of appetite, changes in taste and smell, dry mouth, sore mouth and throat, nausea and vomiting, diarrhea or constipation, and weight loss and muscle loss. So let's take a deeper dive into each of these and talk about some techniques or tips that you can try if you're experiencing any of these. So first, let's start with loss of appetite. With this, it's very challenging to eat. Sometimes eating becomes more of a burden because if you don't have an appetite, simply you just don't feel like eating. And so you kind of have to force yourself to eat. In this situation, I find it easier rather than trying to force a big meal all at one time. Instead, break those meals up and aim instead to have 5 to 6 mini meals throughout the day. Whether that means you're spreading them out evenly, so you're eating every 2 to 3 hours and eating kind of more by the clock and rather than the hunger cue, that can sometimes be helpful. Or if you put that on a tally of, okay, how many times have I eaten today? That can also be helpful. I also find with a poor appetite, that stomach gets filled up really quickly. And so we want to optimize that stomach space as best as we can when you are eating. So try to drink liquids between meals rather than with meals. With those liquids, sometimes choose ones that have calories in them so that they further help you so that we don't lead into unintended weight loss. Some other considerations that to look at is sometimes other factors or other conditions may be affecting your appetite. So if you're having constipation, depression, or if you're even having slow gastric emptying from some of the medications that you're receiving, we'll work with your cancer team, with your oncologist, with your nurse navigators, your dietitian, work with them to see if there's other conditions that we need to be working on to help improve your appetite. Changes in taste and smell. This one is, I find, common with both chemotherapy and also radiation therapy, especially if you're getting radiation to the head or neck. In this case, um, I have also seen multiple changes in taste. So sometimes that can look like little or no taste with foods, or just an off taste. It doesn't taste quite right, or even a bitter metallic taste. In these situations, there are different things that you can try to help make food taste better. Um, I will say it's more of a Band-Aid. It doesn't fully bring that flavor back, but it can help. Now, one thing I have seen that um, has helped is sometimes with those changes in taste and smell, sometimes it can be linked with dry mouth, which we'll talk about a little bit later. But this oral mouth rinse recipe that you see on the right-hand side, this I have found helpful just to reset that palate. Get rid of those bad tastes that may be lingering in your mouth and get it nice and fresh, ready to eat that food. That can sometimes help it taste a little bit better too. Now, with dry mouth, like we were talking about, you'll see on the right-hand side of this slide that there's that mouth rinse again. This really helps rehydrate the mouth without drying it out. Sometimes those more commercial mouthwashes that have alcohol in them, they will dry out the mouth even further. And so this rinse, um, one, I always get people going, salt, is it going to be salty? With the small amount of salt and the larger amount of water, it's very minimal that you taste that. But what it does do is it helps clean the mouth. It helps give really good oral hygiene, but it also helps hydrate. Now, talking about hydration, with dry mouth, that is very key. You want to make sure that you're staying well hydrated throughout to help with that dry mouth. Now, you want to aim for a goal of at least 48 to 64 ounces per day, but as I mentioned earlier, that is a general recommendation. For more specifics in your specific case, or more, I should say, with other conditions going on, please talk to your oncologist or your dietitian. Um, Other things that have been found to be helpful if you are suffering with dry mouth is there are some saliva stimulants, some that are natural, some that are prescription medications. Um, Use what works and work with your oncology team to find a solution for you to help, because a dry mouth can make eating a little more challenging. Next is sore mouth and throat. Now, you'll see that same rinse on there. This rinse, because it's not alcohol based, it's not going to aggravate those sores. And that is one of the key things if you're having a sore mouth or throat. We want to try and avoid foods or liquids that are going to aggravate those sores and make them more tender and more painful. So avoiding alcohol-based mouthwashes, avoiding spicy, acidic foods and carbonated beverages. Try to choose foods that are softer, easier to chew. Even cold foods can can numb those sores and make it a little bit easier to get down. I also find that liquids are your best friend. So going for smoothies, milkshakes, those are going to be very much easier to get down than solid foods when you're having sore mouth or throat. Next, we're going to talk about nausea and vomiting. This I find common with chemotherapy. I also find it with radiation to any of the abdomen. People can experience some of that nausea and vomiting. In this case, it is almost a um, basic reaction as humans for us when we're nauseous to avoid food and liquids, because if we don't put anything in, nothing's going to come back out. Now, that may work in the short term, but if we extend that and look at the long term, that is not going to be helpful for us, because research has found that an empty stomach can trigger that nausea almost as much as that overly full stomach. So we want to make sure that you're eating small amounts of foods and liquids often throughout the day to keep something on that stomach. We don't want to overfill it, but we also don't want to empty. I also find, particularly with vomiting, starting with liquids. Start adding liquids back in and slowly work yourself back to eating more solid foods. Listen to that stomach and it will help guide you through, okay, what can I tolerate? In severe cases, if liquids are not staying down, that is a good time to reach out to your cancer clinic and your care team. Let them know what's going on so that we can help, because we don't want you to get into that danger zone of malnutrition or dehydration. So involve your cancer team. Now, other things that you can also use to help lessen that nausea, you'll see here on the right side, there's ginger, peppermint, citrus, sometimes even smelling some citrus fruits can help. There are also distraction strategies or relaxation techniques that can also help you during those times that you are eating. Next, we'll talk about diarrhea and constipation. With diarrhea, we do want to see if there's any particular food that seems to be triggering that diarrhea, or sometimes even certain eating habits or patterns. For example, with diarrhea, sometimes a large meal can make that diarrhea more likely, just because your body is a little bit more sensitive to too much food at one time. Also, with diarrhea, to help that resolve quicker, we generally encourage following more of a low fat, low fiber, or low lactose diet, even, as that will help slow that gut motility. It will also help you absorb more of those nutrients better. Avoiding sorbitol, which is a type of sugar alcohol that is commonly found in sugar-free foods, gum. That sugar alcohol, we don't digest, we don't absorb. And so it can sometimes make that diarrhea worse. So avoiding things like that and instead using bulking agents like pectin or soluble fiber, because that will help slow that gut motility. It will help resolve that diarrhea quicker. Now for constipation, couple things. We want to make sure that you are well hydrated. If you're dehydrated, it's going to make that constipation worse. We also want to make sure that you're getting adequate fiber in your diet. Sometimes that can be difficult if you also are having a poor appetite. And so using things like fiber supplements, stool softeners also can be helpful in this time. I find also using hot beverages or hot cereal, that just with the fiber in it, or just with the sometimes even sugar that's in there, it can help loosen that stool and make that easier to pass. Now, lastly, we're going to talk about weight loss and muscle loss. This kind of goes hand in hand with poor appetite, as when people have poor appetites, they're not eating as much, and so they do start to have unintended weight loss. Generally, with the increased nutrient needs that cancer patients have as they are going through treatment, this weight loss can be very quickly. And with that rapid weight loss, it is very likely that you are also losing muscle loss. And so oftentimes you will hear your cancer team discourage any weight loss during treatment just because of that high risk of muscle loss. And so things that we do to help um, fight back against that weight loss and to protect your muscle mass is we encourage power packing meals and snacks. Now, power packing is a term that essentially means that we're trying to increase the amount of protein and calories without increasing the quantity of food that you are eating. So this may look like, instead of using skim or 1% milk, we use whole milk, or um, adding melted cheese onto sandwiches, meats, vegetables, eggs, tortillas, adding peanut butter to milkshakes. In each of these scenarios, we are not increasing significantly the amount that you're eating, but we are increasing the overall calorie and protein amount in that food. A little more calorie per bite, if you want to think of it that way. Other things to consider is make sure you are talking with your doctor and dietitian, because there are some medications out there that can help increase your appetite and help make it easier. Also, look and talk with your care team to see if they offer physical therapy, or if it would be a benefit to you to be referred to physical therapy. That way we can strengthen and protect the muscles that you do have, as well as potentially regain some. Thank you everyone for watching for today. I am once again so grateful that you decided to watch this program, and I have listed here the resources that we talked about through our today's class. So Intermountain Health, this is a link for our cancer website, and this has many great I couldn't say that word, resources on it. But it also has this link here about different short videos talking about hot topics in nutrition and cancer. I've also put a link here for the Academy of Nutrition and Dietetics. They are a wonderful source of information for nutrition in multiple conditions. And then more specifically, this website for oncology nutrition, that is a subgroup within the Academy of Nutrition and Dietetics. I've also put the links for the American Institute of Cancer Research and the American Cancer Society. I love these resources. They are ones that I go to because they help simplify the information that is in there, and they put them in actionable steps. So go to these websites, pour through those. I think they're very helpful. These links will also be in the chat, so that way you can click and go right directly to them. Also, I want to encourage you to also look at the Intermountain Health link that's here to check in for future events. As we said earlier, this is a webinar series, and so we will be developing more classes and putting them on, and we'll be advertising for both the live session as well as the on-demand course. So I've also included a link here for a survey. Tell us what you thought of today's class. We really want to get your feedback so we know how we can improve these classes and tailor them to topics that you are most interested in learning about. So either follow this QR code or this link. We'll also put this link into the chat. Now, if you have any direct questions that were not answered today, please feel free to email the bmt_dietitian@imail.org. This email we will be watching for questions, and we'll respond to as soon as we can. So once again, thank you. And we will go and review some of the questions that we received during our live session.
Thank you, Lacey. That was amazing. Yes, absolutely. So one of the questions that we had from our live event was during post-cancer treatments, if you're on long-term meds that cause a lot of fatigue, what can we do to help diet-wise to help keep up energy levels?
And that is a great question. Fatigue is a challenging one. Often diet-wise, what I encourage is let's first take a look to make sure that you're getting enough calories and enough protein in your diet. Oftentimes, if you're deficient in either of these areas, it can make you very fatigued because your body's having to pull from its stores, and rather than having that energy readily available, it's having to work a little bit harder for that. So let's first look there. I also encourage that we look at if there's any micronutrient deficiencies. So that means like vitamins or minerals. Sometimes if you're deficient in those areas, whether that's because you're not able to eat those foods from different symptoms, we want to make sure that you are getting enough of those in, because that can also cause some fatigue. Now, an interesting thing that's not really diet related, but research has found with treatment-induced fatigue that having some light physical activity every day can really help with that. And so I do encourage that people try to get about 30 minutes of physical activity each day. And that doesn't have to be all in one time block, but it can be 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes at night. But trying to get that regular physical activity can be very helpful.
Sorry about that. My mic was on mute and I didn't get it off in time. Then another question that we had from our participants was, are you familiar with the book and PBS show In Defense of Food? Some of the things you discuss seem very in line with this 7-word motto, eat food, not too much, mostly plants. Would the principles taught in this book be a good balanced approach?
I am familiar with that book and that program. And yes, I absolutely love In Defense of Food because it does encourage those basic dietary guidelines that research supports. And so eating food, that means go more for your whole foods, less for your processed. Go for things like your fruits, your vegetables, whole grains. Those are definitely that In Defense of Food book, I do think is a great resource, and using those principles to help you with your diet, absolutely wonderful.
Great. Lacey, how can caregivers caring for cancer patients best support their loved ones during times when they don't feel like eating?
Mm, that is a challenge because oftentimes when they don't feel like eating, it's you almost feel like you're pushing against a brick wall because they're saying no and you're going, I love you and I want to help. How do I help? And not always do you know how to help. So often what I encourage is remind them why they need that nutrition. Let them know that, hey, if you don't get something in, there's a good chance that we could continue down this path of getting malnourished. With that malnutrition, you're more likely to get sick, you're more likely to have more severe symptoms, and we don't want that. And so encouraging them, reminding them that there is a reason, there is a purpose to push through. Um, Also be that support and provide that. Remove those barriers from eating as much as you are able. So if they don't have the energy to go to the kitchen, prepare that and bring that to them. Um, or if there are certain foods or certain drinks that they go, oh, that just sounds good. Keep trying and don't give up on that good work that you're doing. I know it's not easy, especially like I said, it feels like you're pushing against a brick wall, but definitely keep at it with them, be there with them because they really do need that.
That's good advice. Um, so Lacey, can you just remind us how to connect with a dietitian at Intermountain Health if it's something that we feel like we need more personal help with?
Definitely. Now it is a little different, cancer clinic to cancer clinic, but I would say probably the most consistent and best way to get in touch with a dietitian. First, you can definitely email that, or send an email to the bmt_dietitian@imail.org email. Or I would also encourage talking with your nurse navigator or your oncologist and asking for a referral to a dietitian. They have been linked up with a lot of our oncology dietitians throughout Intermountain. So communicate with them. Say, I would like some more information on this. Can you refer me to a dietitian? They can put that order in and that sends it right to us. So
That's great. Thank you so much. Lacey, thanks again for such an amazing presentation with so many great presentations on how we can use food to help either ourselves or our loved ones as we, go through this cancer journey. It's not an easy one, but we appreciate all of the tips and tricks that you have shared with us today to be able to help make that journey just a little bit easier. Again, everyone that's participating, we encourage you to fill out, share your thoughts with us using that QR code that's on screen. And we have put all of the links from Lacey's presentation and resources in the notes section on this. So go ahead and check that out. and come back frequently. We are going to have more live events, and we will also have more on-demand classes as we continue on. So thank you again, Lacey, and thanks everyone for participating.